First of all, I'm very obrigado for the invitation because I was invited 1 year ago by Paolo here in Curitiba, and we spent a couple of beautiful days together, and so he invited me to this meeting this year, and so I was very happy to come again in Curitiba and to have the chance to speak to your meeting. Well, I'm here in Brazil because 2 years ago it was translated into Portuguese one of my last book that was titled O Doente Imaginado. O Doente Imaginado is a patient that is constructed by physicians and by industry, because it's a patient that, more than a patient, is a consumer. So a doente imaginado is a consumer. It doesn't matter if it's sick or is healthy. What is in the interest of industry and of physicians is that he's a consumer of drugs, tests, and so on. So I think that O Doente Imaginado is a sort of introduction of all the discussions that we are doing today regarding choosing wisely. Well, I'm doing a step back, and I explain why I'm here. I'm here in this meeting because in Italy, choosing wisely was conducted, was coordinated by slow medicine. What is slow medicine? In 2011, while in the United States choosing wisely started, in Italy a group of physicians, a group of friends, started to discuss about what we like and what we don't like about medicine, today's medicine. So we think that medicine have done a great progress, a great success. So we know how many efficacious drugs we have, how many diseases we can treat and solve. And so in the last 20, 30 years, we obtained enormous results in the medicine. But also, we know that nowadays we are doing too much. And sometimes we use drugs and technology in an inappropriate way. And so we waste resources. And as Luis told you before, because I can understand a little bit of Portuguese, and we are not concerned about waste because we are not administrators, we are not the responsible for the national health system, so and nor of insurance, but we think that we are concerned about the overuse of medicine, of drugs and tests, because they can harm patients. Because the overuse of drugs is pretty easy to understand, that there are side effects, interaction between drugs, so it's intuitive. It's intuitive that an overuse of drugs could harm patients. But it's not so intuitive that overuse of tests can be dangerous. But it can be dangerous because you can find every one of us has some abnormality. None of us is completely normal. We started from this consideration that people live longer, many incurable diseases were defeated, patients are more aware and informed, treatments are more efficacious, services are more accessible, diagnostic tests can explore any part of the body, and labs can analyze thousands of substances. But, I'm sorry, I have to learn how to work with it. But we also thought, the group of physicians who started to think about slow medicine, that medicine is filled with inappropriateness, wastes, conflicts of interest, and mental models that induce professionals and patients to consume more and more healthcare services in the illusion that is always better doing more for improving health. So the other way, okay. So the interest of today's medicine is mainly focuses on technologies, while the person, along with the relations with his, her family, and the social environment are completely neglected. So we look around in the literature and we saw that an Italian cardiologist published a paper in 2002 saying convite para slow medicine. And we found there are several books published in the United States in which they used the expression and the word slow medicine. And I want to remember Dennis McCulloch, that he wrote one of those books, who suddenly died a couple of, in June, last June. And so we are pretty sorry because he went in Italy for our national meeting, and so we are pretty sad about that. So it was founded in 2011, as I told you before, as a movement of physicians, health professionals, patients, and citizens, because our aim, like in Choosing Wisely, is to have an open discussion between patients and physicians and citizens, of course, because we cannot go ahead, we cannot change our paradigm of medicine without an open discussion with patients. Because we cannot change our mind if in the same time patient's mind can be changed. So we are aimed to promote the processes of care based on appropriateness, but within a relation of listening, dialogue, and decision sharing with the patient. So I don't know who knows the slow food movement. Anyone knows it? Open hands? 10, 15%. Well, the adjective that slow food movement chose to define the movement is an alimento, bom, limpo, e justo para todos. So we decided to use the same sort of logo, two snails instead of one. Why two? Because one is the patient and the other one is the physician, who are talking about slow medicine. And we also defined the three words to define the medicine we would like to see. Sobria, that's in Italian, but it's almost similar in Portuguese. Sobria, respeitosa, e giusta. What does it mean? Sobria means fazer mais não quer dizer fazer melhor. My Portuguese is not so good. Sorry, I apologize. But you can read and you understand better. Then, okay. Respeitosa means os valores, expectativas e desejos das pessoas são diferentes e invioláveis. Justa, cuidados adequados e de boa qualidade para todos. And that's exactly what Luis told you before, that here, everywhere in the United States, in Italy, but here in particular, there is a big difference between the private and the public services, between poor and rich people in terms of health services. So we think as a slow medicine that medicine must be used. So, and so we started to think not only on medicine in terms of clinical medicine, but also in terms of a whole way of thinking. So we think that we can have a slow project in clinical research, in prevention, in health education, in developing new technologies, in rehabilitation, in hospital management, in safeguarding the environment, because patients are involved in environment. It's not part, are not alone in the world. In constructing a partnership with citizens and patients. And so, what we want to change, the excess of medicalization of daily life, prevention considered as a sum of tests and treatment. So, as you know, most patients say, comes to your office, say, doctor, I need to do all tests because I want to prevent diseases. And so I need to take a lot of drugs in order to prevent diseases. We don't like this way. The abuse of no evidence-based drugs, clinical research driven only by economic reasons, appropriateness based on state rules, and conflicts between patients and physicians. And of course, you are against defensive medicine. And we have to find a way to avoid defensive medicine. And so we are fighting what we call the 7 poisons of past medicine. So some conceptions that are very common in the overall population. New is always better. Well, sometimes new is better, but not always. All tests and treatment used in clinical practice are effective and safe. We know that sometimes they are very effective and very safe, but not always. Technology will solve every health problems, but we know that sometimes technology creates problems. And so we have to invent some new technology to avoid the problems created by the first technology, and so on. That's the economic system works, to produce something that can solve the problems of what we have created before. Doing more helps recover and improves the quality of life. Early identification of a disease is always better. The risk factors have to be treated with drugs, and emotions and moods can be controlled with medical treatments. So those are poison because they harm the relationship between patients and physicians, and are a poison that affect our daily life. So slow medicine became, in the years, an association, a website, a manifesto, a book, a net of scientific societies and hospitals, a Facebook, a project involved the international Choosing Wisely project. Okay, so let's skip everything. I skip about my book because I told you before something. So, slow medicine is spreading around the world. Yesterday night in Sao Paulo, we had the lanciamento oficial de slow medicine do Brasil. And so here there is José Carlos, who will introduce a little bit further. So that's the website of Slow Medicine Brazil. Those are the 3 founders of Slow Medicine Brazil, and this is José Carlos. And I skip all the some other information. So you know what Choosing Wisely is, so I don't waste the time. Just to say that while Choosing Wisely was founded in the United States, we founded slow medicine in Italy. So when we knew about Choosing Wisely, we saw that our first objective that describe the way we would like medicine, sobria, is exactly the definition of Choosing Wisely. So in Italy, Choosing Wisely was coordinated and launched by Slow Medicine because our first message is to give a sobria, to think about a sobria medicine. So we had many partners, and of course, as Luis told you before, we focused on the characteristics of the Italian medicine. So the first point, the tests that are commonly used in Italy, and so that why we made Choosing Wisely Italy. So then we worked with a citizen association called Altro Consumo, another consumer, and with them we translated into a language comprehensible by citizen and patient the recommendation that have been defined by the scientific societies. So you can see here the brochure and all the subjects that we used. So those are the societies that joined the project in 2014, those in 2015. Then there are more. I show you one picture on your left side, what is done in the United States, and the other side in Italy, and so on. Then we started to do a project in an hospital, but I'll tell you in next conference, so stay here because otherwise. We started a project to introduce the Choosing Wisely principle defined by families medicine in the territory, discussing the subject with the patients. We prepared some material for the patients. We started also a project for prevention, Cultivamos a Saúde, Prevenção Positiva, o valor de la saúde, uma ideia salvador de saúde a crescer. I translated with Google, so I don't know if it's I prepared yesterday night, so in case then, forgive me. Anyway, so we are thinking a prevention in terms of a positive action, a happy way of saving your health. Because prevention is usually so as a way to scold people. Avoid smoking, avoid eating good things, avoid sex, avoiding everything. So instead, we can think of prevention in terms of policy. So we participated at the, well, here there are the two Brazilian representative of Choosing Wisely International. We had, and so I stop it here. So I'm becoming too long. Just to tell you that the slow medicine movement, it's a movement, as I told you, of physicians and patients that want to change the paradigm of medicine. It's a movement that now is spreading around, that now is started from yesterday night, also here in Brazil. So I encourage you to join that movement because the slow medicine movement is something more holistic, has a more general view than Choosing Wisely. So that's the reason why Choosing Wisely in Italy is is one of the projects of slow medicine. And so I think that we can discuss more during the discussion. I'm staying also tomorrow, so I have another lecture, another palestra tomorrow. So if you are interested, we can discuss more later on. Thank you very much for your attention.